Good morning, my name is Boris Vargas. I am in the course of 4th D of the medical career. This subject is called Inglés Médico and our teacher is Dr. John Moscoso. Here the topic of the research that I am exposing here is a randomized controlled trial of oral propanolol in infantile hemangiomas. Now we're going to define what is an hemangioma. As we can see here on the image, this baby has on the face a red spot that is caused by an internal existence of vessels that are very numerous and are in a high concentration of blood that make there appear a spot that we can simply see by exterior sight. Here we define the oral propanolol that has been used to treat complicated infantile hemangiomas, although data from randomized controlled trials to inform its use are limited. What is an infantile hemangioma? They are benign vascular neoplasms that have a characteristic clinical course marked by early proliferation and followed by spontaneous involution. Hemangiomas are the most common tumors of infancy and usually are medically insignificant. Well, here, what do we refer with a randomized controlled trial of oral propanolol? We perform a multicenter randomized, double-blind, adapted phase 2 to 3 trial assessing the efficacy and safety of pediatric-specific oral propanolol solution in infants 1 to 5 months of age with proliferating infantile hemangioma requiring systemic therapy. Infants were randomly assigned to receive placebo or one of 4 propanolol regimens, 1 or 3 mg of propanolol based per kilogram of body weight per day for 3 to 6 months. There we got a video that we can see later because I just add everything to the link. The applications in medicine are that historically medical care of clinically significant hemangioma has been limited to a few medications including glucocorticosteroids, topical, intralesional and oral, interferon alpha and rarely vincristine and topical imiquimod. Beta blockers, most specifically propanolol, have been shown to induce involution of infantile hemangiomas and are now considered first-line treatment for problematic infantile hemangiomas. Well, here we get another video that we're going to jump. What are our pros and cons? In pros, we get that here it is used, we're talking about propanolol, okay? In our pros, we have that it is used to treat proliferating infantile hemangiomas, lumps or tumors, non-carcinogenic. Propanolol is a class of medication called beta blocker. It works by narrowing the blood vessels that are already formed and preventing them from growing new. And our cons are that propanolol can cause side effects as trouble with sleeping, vomiting, diarrhea, serious agitation, cold hands or feet. And other can be serious as pain, difficulty in breathing, irregular or slow heartbeat, and sudden weakness in an arm or leg. Well, this issue applied in Ecuador, we say that there is an FDA approved formulation of propanolol solution indicated for the treatment of infantile hemangiomas for infants aged 5 weeks to 5 months. In this country, we also set propanolol as the main answer to this issue. Now we can conclude that this trial showed that propanolol was effective at a dose of 3 mg per kilogram per day for 6 months in the treatment of infantile hemangioma. Thanks for your attention.